All right, hey, why most functional medicine weekend seminars are actually setting you up to fail, and what do you got to do instead? I've been in those rooms, and I'm going to tell you exactly what's happening. Okay, so I'm Dr. Zac Watkins. I've built and operated a successful multiple functional medicine centers over the last 25 years. I've had the luck to consult with well-known laboratory companies and multiple doctors across the country in how they build out their practice, their systems, their operations, mentor them, and that's why I'm here to give you value. So let's talk about the seminar trap, is what I call it. First of all, I've been there. I love seminars. Actually, I still do to this day. I love traveling. I love getting out and seeing new places and staying in nice hotels and researching the great gyms that are locally. I like doing that. Maybe my wife comes with. We spend time together. But I think growing up in business and in practice, what happens is you start getting into a trap. And the trap typically is that you're stuck, you sign up, you fly out, you spend the money on the hotels, you spend the money on the food, you get a ton of knowledge, lots of great information. That's not what I'm arguing about. It's just when you come fired up and you come ready to really implement and you're excited, but then what happens is you're noticing nothing's really changing. Nothing's really changing in your practice, nothing's really changing in your revenue, most importantly. And it's not because you're not learning enough. It's usually because you're learning everything else, but how to implement it, actually use it in the day-to-day practice. And I am number one victim to this. And again, not that it's bad, and there's a lot of great lecturers and teachers. It's just I actually know providers who are causing financial strain to their families because they think the more they go learn, the better it is. And the more that they become educated, and people will just flock to their door and give them money, which does not happen. But I did do that myself. I've got multiple certifications, and because the more I felt the better I would be positioned. Honestly, if I can put the mirror in front of me, that's a reflection issue. That's a issue with me valuing who I am. And I would suggest maybe there's a lot where a lot of providers are as well. So this is by no means telling you not to do seminars. It's just saying that we got to be intentional with what we're doing. Okay, so there's something that I do want to say out loud that I do notice when I'm working with providers and we're talking about lab work and some mentorship kind of stuff. And I kind of call it like a little bit of a dirty secret. And that is that some of those doctors that are probably teaching a lot of the stuff that you're learning are probably not the ones even ordering them. Meaning, are they even doing what they're talking about? I've come across this. I'm not saying this is everybody, but I do think this happens quite a bit. It's not necessarily you learn some information like different testing methodologies and stuff, and then you implement. It's more of you learn and then, okay, shoot, now I got to buy the next course in that process. And then now what? Now I got to learn some more and then I got to buy more. And I think that's the loop that practitioners get in. And all it is, it's more profitable for them, which is great, capitalism at its finest. But then it's going to be more expensive for you, the clinician. And in the end, I don't want to see that for my fellow practitioners because they're losing time seeing patients that they could see. And I, right here, will tell you, I am not the smartest person in the world, and nor do I want to be. I have come to learn over time that the knowledge I gained is important, but even the credentials, certifications, all the post grad stuff that I kept piling on never really mattered. When I told patients that, when I was at an event and I would speak in front of people, nobody even knew what that was, nor nobody cared. And what that always taught me is that who's going to win is the clinicians and the practitioners who can really connect with their patients in a way that creates momentum, creates value, creates trust, more importantly, creates clarity. Okay. So I just want to say that the gap is not necessarily clinical knowledge that a lot of us think it is. All, chat with some people back and forth will say, I'm considering actually doing this program now. And now this program, there's a new program that came out. My alma mater just added a new cool program that I, for a split second, said, oh, I should do that. But I think the issue is not necessarily the knowledge, it's going to be more the translation of that knowledge. So you can read all the labs, you can convert that into a confident conversation that gets patients to buy into you, say yes to your process. And that's the big piece that's really missing with a lot of providers, but nobody's really talking about that part. Again, I say this with love for my fellow practitioners. But when I'm even consulting with practitioners or doctors, and they'll ask me about, hey, can I order these certain lab panels or lab markers? And first of all, I have never heard of a lot of them. And I'll start doing research from a lot of the well-known labs to find where we can find it. Even if it's a very specialized lab, I can still not find some of these labs that are out there. And I've been in this situation because I'd go, I would learn, I'd be told, basically sold, you have to basically do this profile to identify whatever, certain anemias or something, which I know it's relevant. But when I got back home and I'm building a business by myself and I got a family to take care of and a wife and newborn kids, I start looking for these lab markers in different lab companies, cannot find them anywhere. So now I am not as confident as I was because I just feel lost and confused. And I'd even reach out to the companies and ask them, hey, so and so talked about these markers. I cannot find them anywhere. And they would actually come back and say, well, a lot of these markers are research based, and you're not going to find them unless you're actually like research institutions ordering these labs. And then my head goes to, how does this help me make money, serve patients, and get results that we need? That's what was very frustrating to me. And I'm still seeing that to this day. And I caution practitioners that you don't need to go learn more. I talked to someone the other day. I was like, what do these labs tell you? Well, it tells me, and they give me some results and some information about what I was going to tell them. I'm like, that's cool. Then what are you going to do? Well, it's pretty much going to confirm what I already think. I'm like, okay, so what's the point? And are you going to be able to convince and talk to your patient enough and lay out what the next step is, but also get them to spend the extra $150 on one little marker that is very esoteric and out there that we don't even see? And the consensus was, well, no, it's just going to make patients more frustrated because they're back to where they start, which is, how do you help me? And that's a big thing we'll get into some other time. But being a clinician is a blessing, and it's great to work with other clients and practices and practitioners. But when it comes down to it, a lot of it is marketing, just like anything. And this isn't a bad word. Sales is not bad. Marketing is not bad. But you need to tap into what your patient in front of you is there for. What are they there for? What are they feeling? What are they hurt? Where's their pain? Some crazy lab that is done in Greece that you have to ship it overnight in dry ice may not be what they need to solve their pain. It may be cool and back up some nice things that you're thinking, which I agree because I've done this, but it may not create the change in your patients that you're looking for. They're going to be frustrated with you because they just spent a bunch of money, and you're going to be frustrated because you were told to do these things and it's not translating into the practice that you thought. Okay. So actually, the doctors who are enrolling patients right now, we say enrolling, onboarding them into their practice, they're the ones that are not really the most trained. I got to be honest, but they are the most implemented. And what that means is they have more of a system set up, they have more of a framework set up, they have more of a way to present findings that builds more trust, clarity, and authority with people and patients to help them move forward. So if you are watching this today and you're sitting there on multiple certifications and degrees, I'm there myself, but you haven't been able to use them the way that you want, or you feel a little jaded because it's not returning on the investment you put in, I'm curious, just drop a comment below and just let me know what you're doing. This isn't to bash associations or certifications or whatever it is. That's not the point. I think, and I'm the first one to say this, I think a lot of the times it's practitioners thinking they're doing something value, but in the end, they're not moving forward. So they think they're adding value, but they're not. But it makes them feel good because they're doing more learning, education, but it's not moving forward. And that's tough love, but I had to tell myself this, and I still do. I actually did this morning for a business conference that I'm looking at. I think a lot of it is meeting my insecurities of, I don't think I know enough, so I need to go do more, or I need to do this to be around these certain people. And in actuality, I have a lot of the answers. I have a lot of the tools, and I have a lot of the clients that I serve that show me that what we're doing is correct. Okay. So I'm curious where you're at. Go ahead and drop a comment. Tell me what that gap feels like for you. Like, do you feel large? Like, I don't know what to do. I feel like I'm sitting on a whole pile of education, but I'm still not impacting my community or the patients that we're serving. Or if you want to see how exactly we're solving this for other practitioners, probably in your same boat, go ahead and DM me or my team, message us directly. We'll show you what that looks like for you and your practice. So be well, and thanks for your time.